Acupuncture has been used for thousands of years to treat thousands of different conditions. I commonly get asked about acupuncture for the treatment of chronic pain. So today, I'll answer the top 10 questions that people ask me about acupuncture for chronic pain. How acupuncture works for pain. What kind of pain can acupuncture help? Are acupuncture needles reused? Does acupuncture hurt? Which points hurt most? Where acupuncture originated from? Is acupuncture and dry needling the same? What happens if acupuncture goes wrong? Can the needles break inside my body? Which acupuncture points are contraindicated in pregnancy? So, let's talk about acupuncture for pain today. I am trained as an acupuncturist. In fact, it was acupuncture that introduced me to pain medicine. When I was in medical school in the internship, our team admitted a woman in the general internal medicine ward. She had pain all over her body and nobody knew what she had. Nobody could touch her because she had allodynia everywhere. She didn't move and was bedridden and very depressed. No medication had worked for her. We ordered all kinds of tests, blood tests, imaging, neurodiagnostic tests. They all came back normal. My supervisor asked a consult to physiatry, and when the doctor came, he diagnosed her with fibromyalgia and did one session of acupuncture. She got up, was walking up and down the ward. Her pain had vanished completely. I then became very interested in the science of pain, and that's why I am a pain doctor today. Before I continue, let me remind you that this video is not medical advice. This video is for educational purposes only. If you have any emergency, go to the nearest emergency department or call an ambulance. Acupuncture is any intervention where needles are inserted into the skin to treat a health condition. There are various schools and each uses different methods. Acupuncture that is practiced in traditional Chinese medicine involves the classical 12 meridians that connects the points. They also use Ah-shi points that are like what we call dry needling in Western medicine. Traditional Chinese medicine also uses Moxibustion, cupping, and electrical stimulation in addition to the needling itself. Korean acupuncture usually applies a maximum of 4 needles per session, and Japanese acupuncture uses shorter needles. There are some techniques that insert needles in the scalp, the ear, hands, and feet. Dry needling involves stimulation in points outside of the meridians. I use dry needling when I find myofascial trigger points and I want to inactivate these points. Dry needling is very similar to trigger point injections, but without injecting anything. The other difference between acupuncture and dry needling is that in acupuncture, the needles are left for 20 to 30 minutes, and in dry needling, that is not necessary. We stimulate the points and remove the needles immediately. When the needles are inserted in the skin, the acupuncturist does manual stimulation. There are various sizes of needles. Depending on the place in the body, the acupuncturist will choose shorter or longer needles. They are usually very thin. Ideally, they should be used only once and be disposed after the first use. But in some places, the person owns a set of acupuncture needles and they are sterilized between sessions. Acupuncture is usually well tolerated. The needle insertion is done very quickly and the needles are very thin. However, there are some points that hurt more than others. For example, when the points are in the face, in the hands, or feet. Dry needling is usually more painful than meridian points acupuncture. And of course, if the person is more relaxed, the skin and muscles will be easier to be perforated by the needles and therefore will hurt less. So the big question is, why inserting needles in the body alleviate pain? Well, if you like this video so far, subscribe to this channel and turn on the notifications button, this little bell here, so you can notified when I post new videos on this channel. The explanation is simple. They activate the body to produce its own painkillers. I have another video that I talk about the brain's inner pharmacy. We have the ability to produce our own endorphins, which are potent opioids. And in the case of acupuncture, when our brain releases these powerful painkillers, it will take approximately 7 days to break them down. So this is why the analgesic effects of acupuncture are usually short-lived. But if you compare the analgesic effects of acupuncture with those of taking a painkiller pill, it is not bad. It is like taking one tablet that lasts 1 week. The main disadvantage is that the person must go to an acupuncturist, and it's usually a very expensive kind of treatment. In the case of the woman that I mentioned earlier, we discharged her from the hospital the next day after the acupuncture session, but my colleague who did the acupuncture, he kept seeing her to do more acupuncture sessions, but also to teach her other strategies to control her fibromyalgia pain. If she doesn't use the pain-free time to exercise and return to normal activities, she will not get better. The analgesic effects of acupuncture only last a couple of days to a few weeks. But in the case of chronic pain, the person needs to learn self-management skills. I have many other videos about the 5M of self-management, many videos of exercises, mind-body therapies, meditation, nutrition, and sleep. It is important to choose an acupuncturist who is trained in this kind of treatment, that knows anatomy so they don't cause any damage to a body structure, and also use disposable or sterilized needles. So if the effects of acupuncture are short-lived, why are they recommended for chronic pain? In many cases of chronic pain, acupuncture can be an efficient method to be added to a multimodal program of treatment. This is helpful because acupuncture can be used instead of medications that have many side effects. For example, opioids can cause somnolence and constipation, in addition to the dangers of dependence and tolerance. NSAIDs may cause stomach upset and aggravate high blood pressure and cause a myocardial infarct. When the pain gets better after a session of acupuncture, the person needs to practice the other modalities and strategies to resolve the chronic pain problem. Remember the 5M that I mentioned for chronic pain? Movement, mind-body, modalities, manual therapies, and medications. Acupuncture is in the class of modalities, so adding other self-management strategies like movement or mind-body therapies will complement the effects of acupuncture. In my other video about the 3 types of pain, I explained that chronic pain can be of 3 mechanisms: nociceptive, neuropathic, and nociplastic. Acupuncture can be used for all kinds of pain. Nociceptive pain includes pain from inflammation, myofascial trigger points, springs and strains. It also includes low back pain. The recently published guideline from the World Health Organization on the treatment of chronic primary low back pain recommends the following. Needling therapies such as acupuncture may be offered as part of care to adults, including older people, with chronic primary low back pain. It's a conditional recommendation in favor of use with low certainty evidence. Acupuncture can be used for cases of neuropathic pain, which includes pain conditions like neuritis, neuralgias, lesions or diseases in the brain, spinal cord, and nerve compressions. Acupuncture is also indicated for the treatment of nociplastic pain, such as fibromyalgia, migraines, and complex regional pain syndrome. It is important to remember that not all people who are submitted to acupuncture will have the same beneficial results. Some people do not experience pain relief at all, We don't know why some people do not respond to acupuncture. When acupuncture is tested in randomized control trials, the scientists compare it with sham acupuncture, which is a kind of placebo needling. It is interesting that in many of these trials they show that either real acupuncture or sham have both the same effects. But acupuncture is not without any complications. The most common are pain during the stimulation, skin irritation, bleeding when we pierce a vein or artery, and in most severe cases there might be nerve, spinal cord injury, pneumothorax, or perforation of organs. When the needles are reused or of low quality, they may break inside the body, and then the person will need to see a surgeon to remove the needle immediately. Acupuncture should not be applied in a skin area that is damaged, like a burnt area, open wound, or infected skin. Finally, pregnant women who receive acupuncture, however, there are some points that if they are stimulated too much, they can provoke uterine contractions and lead to labor or miscarriage. These points are usually located on the upper part of the shoulder. Visit my website www.drandreafurlan.com to get more information about chronic pain. I have many resources that you can download if you have chronic pain. And I also offer online courses for healthcare professionals who want to learn more about how to treat people with chronic pain. Answer this question in the comments below. Have you used acupuncture before? Did it help or not? Thank you for watching. Goodbye.